because of how Dr. Yackney listened to people, patients when they talking to him. And I like the way they treat people.
So Dr. Yacknick had a good bedside manner?
Oh, yes. Oh, yes.
If you want to say Dr. Yacknick had a good bedside manner because...
He listened to the patient, and I really like Dr. Yackney for that.
And the staff?
Oh, they wonderful. All of them.
Very sweet.
Yeah.
And if you just want to say the staff at Advanced Pain is great because, can you just say that first and then tell me why?
The staff at Advanced Pain is really, they care about their patients. And that's why I like Advanced Pain.
That's great. Have you seen other, or had you seen other doctors before Dr. Yacknick, or was he your first interaction with a pain management doctor?
They tried to get me to go to other doctors, but once I got started with Dr. Yackney, they couldn't get me to go nowhere else, so I'm just stuck with Advanced Pain and Dr. Yackney.
And how long have you been a patient of his?
Ever since he been to Augusta.
So a long time?
Yes.
Okay, good. How do you think your life has changed since meeting him?
It has changed drastically because at first I couldn't sit long, I couldn't walk or whatever. But once I started treatment with Dr. Yackney, I'm doing a lot of different things that I couldn't do before. Before I met him, I started going to Advanced Pain.
Good. What kind of therapies were you treated with when you met with him? Was it a combination of things, or?
Yes, it was. It was until he found what was the best term for me to be treated with. And then we started with the medication that he fixed up for me to use. Was the best way for me because the shots and all didn't really work. So Dr. Yackney said, well, we're going to work on. He went through certain things that would be better for us to use for my pain. But he's a good doctor. I like him. Dr. Yackney is.
So would you say that he, the therapy that he used for you was just specific to you?
Yes, it was.
And if you just kind of want to maybe say that in a sentence, like, you know, the therapy Dr. Yackney used for me was tailored to my needs, or, you know, was...
Well, Dr. Yackney did, make sure it was just for my needs, that the therapy that he did for me was just for me. And it worked. It worked. And I feel good about the therapy that he gave me. And when I needed change, he'll come and say, well, we'll change your therapy if you need more medication or less. And if I feel like I don't want to cut back on my therapy, he'll say, well, we'll try it for maybe 2 weeks. And then we go back to the same. If it don't work, we go back to the therapy we was doing before.
Okay, good. Are you picking everything up okay?
Do you want to try to do a recommendation?
Yeah. Would you recommend Advanced Pain to anybody?
Yes, most certainly.
And if you just want to say, I would recommend Advanced Pain.
Yeah, they're not going to hear her. They'll only hear you.
They're not going to hear me saying the question, so they're going to hear you answering. So you want to say, you want to tell people why you would refer them to Advanced Pain.
Okay, I would. Let me get it together.
No, you're fine. This happens.
What I do, I would recommend people to Advanced Pain because Dr. Yackney sit down, talk to the people, and listen. He listens. Most doctors don't have time to listen to what the patient is telling them, and he does. And a lot of people look for that in a doctor. And when he sat down and I explained what kind of pain I had, that's what hooked me. So that would be good for other people, I think. Yes, I would recommend advanced pain to other people.
That was great.
That was a good one.
I like that
Yeah.
one a lot. Touched upon it, with the therapies that he's using for you,
Mm-hmm.
the combination of different things to treat you,
Mm-hmm.
or treat the pain. Can you explain that process and how it helped you, like with your mobility, or to achieve, even if they were small goals, like if they helped you accomplish what you wanted to,
Mm-hmm.
Overcoming that pain, how he kind of helped you get through that?
Well, one therapy he did was they did injections in the back.
Mm-hmm.
That therapy, it worked, but I had so many. My back is fused, and it worked for a while, and then it wouldn't work anymore. So we decided that it was better for me to stick with the pain medication because I had so much so much scar tissue in my back, and the medication that he fixed for me to take was was better than, and then the injection stopped working. But the medication is doing good. So that's what I use. It works for me.
And before you met with him, you were in so much pain, you could hardly get up, right?
Mm-hmm.
So after meeting with him and going through the different therapies, you're a lot more
Mobile.
and active, right?
Yes.
So if you could just say that in a sentence, when I first met with him, I was this way, and now, since being his patient, I'm this way.
Well, when I first met Dr. Yagner, I couldn't do nothing. I didn't want to go to the store. I didn't want to do anything because I hurt so bad. But once he started treatment, I got to the point that I can take and go to the store. I can take him, because one time I was using a wheelchair, and because the pain was so intense. But once I started going to Dr. Yagner and getting treated for the severe pain, things started getting better. And then I stopped using the wheelchair, and then I went to the walker. And then Dr. Yagner kept on, the injections that he started giving me, one lasted for a year, and then I didn't have no pain. And then I went back to the high heels, and I was just enjoying myself. And then Dr. Yagner, after that year, I needed another injection, and it didn't work, but it eased the pain. And after that, I can deal with it now. But once you get it here, you can deal with anything. And
he helped you with that too, dealing with it, not only...
Yes, he dealt with the body, the mind, the heart, and the pain.
That's good. Questions over again, maybe just a few of them?
Okay.
Maybe just the first one, why you chose advanced pain. We'll just run through, just so we make sure we have enough.
Okay.
One more time I'll ask you why you chose Dr. Yagner and advanced pain.
Well, advanced pain and Dr. Yagner came out through Walter Rehab. And when he left Walter Rehab, I followed him just like the mama kitten. The little kittens follow right behind the mama. And that's exactly how I did. I liked his way of treating patients. And that meant a whole lot to me. And everybody I talked to, if they got pain, I said, you need to give him the phone number. You need to go to Dr. Yackman, because he listened. And that's more important to me than anything. If you don't feel like it, he said, well, later on we'll talk about it again. And that's the way I can deal with that.
Good. And then, would you refer him, of course?
Yes, I refer him to everybody. Word of mouth means a whole lot to a doctor, especially if you're doing good. If you're not a good doctor, I'm not going to tell nobody about what is, you know, I wouldn't tell nobody to go to that doctor if he's not a good doctor. But if he's a good doctor, I tell them all. I always do.
Good. Okay. Well, good. Do you think we have a little bit?